Yes, so good evening, everyone. Yes, so am I audible to everyone? All right. Yes, so good evening, and I welcome you all to this particular image based sessions on the pulmonology part 2. So, yesterday we have discussed the image based questions on the pulmonology itself, and it was part 1. And I have started this series of the image based questions on the general medicine. And this particular image based questions I'm doing every day at 10:30. And these image based questions are related to the topics of the general medicine. So before starting the session, let me introduce myself. I'm Dr. Rajesh Guba. I'm the general medicine educator on Arise Medical Academy. So with this brief introduction, let us start with the multiple choice questions on images related to pulmonology. Now, if you see the first question, most common cause of the condition in X-ray photograph is Klebsiella pneumonia, Haemophilus influenza, Serratia marcescens, Streptococcus pneumonia. Yes, who will be the first person to answer this question? And first of all, you people should be able to crack the diagnosis of this chest X-ray. Right, very good, Vijay Bhargava. So, can anyone tell me what is the diagnosis of this particular chest X-ray? What is that abnormality you are able to find? So, this particular abnormality, it is nothing but pneumatocele. Right, it is nothing but pneumatocele. It is not lobar pneumonia. It is not lobar pneumonia. Whatever the ring enhancing structure you are seeing, right, whatever the ring enhancing structure you are seeing, right, so this is nothing but the pneumatocele. This is nothing but the pneumatocele. Okay, now what is pneumatocele? Pneumatocele, it is an air filled sac, right, air filled thin sac. Okay, so that is what is your pneumatocele. Now, where do you see or where do you observe these particular pneumatoceles? This pneumatocele is seen in patients with the Streptococcus pneumonia. Right, it is seen in patients with the Streptococcus pneumonia. Now, everyone was thinking that it to be a lobar pneumonia. But in case of lobar pneumonia, right, in case of lobar pneumonia, what should be that peculiar finding? Lobar pneumonia, it should contain the presence of air bronchograms. Right, lobar pneumonia, it contains air bronchograms. Right, it contains the air bronchograms. That is what you will see in case of lobar pneumonia. right? And what are the organisms which will cause lobar pneumonia in the options given to you? Anyone? What are the organisms which will cause lobar pneumonia in the options which are given to you? So, Klebsiella pneumonia will cause lobar pneumonia. Streptococcus pneumonia will also cause lobar pneumonia, right? Klebsiella and Streptococcus, both of them, they will cause lobar pneumonia. Now, in lobar pneumonia, what is that abnormality I have said you? Presence of air bronchograms. Now let me show you that. So this is the chest X-ray of lobar pneumonia, and you can make out it is the entire right upper lobe of the lung. Right, it is the entire right upper lobe of the lung. It is consolidated. Right, it is consolidated. And this right upper lobe of the lung consolidation is most commonly seen in Klebsiella. Right, it is most commonly seen in Klebsiella. Now, this black and white interface, this black and white interface, whatever you are seeing, this black and white interface right, this black and white interface, that is what is called as air bronchograms. Right, that is what is called as the air bronchograms, seen in case of lobar pneumonia. And right upper lobe is commonly involved in patients with the Klebsiella pneumonia. Right, it is what commonly seen in Klebsiella pneumonia. Now, that is about the pneumatocele. So, pneumatocele, where do you come across that? You will see that in Streptococcus pneumonia, not in case of the Klebsiella. And whatever the chest X-ray which has been shown to you, it is not lobar consolidation. It is your pneumatocele. All right, next. Then, followed by that, you see the next X-ray or next image. Yes. Can anyone tell me what is the findings of this particular chest X-ray? Right, what are the findings of this particular chest X-ray? Yeah, Rajkumar, if it is an air-filled sac on percussion, you will have a hyper-resonant note. Yes, Rajkumar, if it is an air-filled sac on percussion, you will have an hyper-resonant note. Okay, right. Now, please tell me what are the findings in this particular chest X-ray? Very good, Asma. So it is the presence of the patchy consolidation. Right, it is the presence of the patchy consolidation. Right, it is the presence of patchy consolidation. Now, where will you see this patchy consolidation? You will come across that in patients with the bronchopneumonia. Right, you will come across this in patients with the bronchopneumonia. Now, can anyone tell me what is the most common organism causing patchy consolidation or bronchopneumonia? Yes. What is the most common organism? causing bronchopneumonia? Any one of you, please. Very good, Asma. So it is Staphylococcus aureus. Right, it is your Staphylococcus aureus. So Staphylococcus aureus, that is the most common organism which will cause the bronchopneumonia, where you have the presence of the patchy consolidation. All right, next. Now you take the, yes, this is another important chest X-ray. You see the question. Appearance as seen on the X-ray photograph of lung is not found in varicella pneumonia, disseminated tuberculosis, Klebsiella, low efflux pneumonia. The question asked is not found in. Right? So what is the pattern you are seeing in the X-ray? What is the pattern? Can anyone tell me what is the pattern first of all? This is called miliary pattern. Right? This is called as the miliary pattern. Okay. Or this we call it as the snowstorm appearance. This we call it as the snowstorm appearance. Right, this we call it as the snowstorm appearance. Okay, now this miliary pattern or the snowstorm appearance is seen in patients with the varicella zoster pneumonia, seen in patients with the disseminated tuberculosis, seen in patients with the low efflux pneumonia. But whereas in Klebsiella, just now we have discussed, they will have lobar consolidation. Right, they will have what is called lobar consolidation. Okay, so the answer here is the Klebsiella. Right, so appearance as seen on the X-ray photograph of the lung is not found in case of Klebsiella. So in Klebsiella, you have the presence of lobar consolidation. Now, can anyone tell me what is Loeffler syndrome? Anyone? What is Loeffler syndrome? Right. So what is this particular Loeffler syndrome? Loeffler syndrome, it is a hypereosinophilic condition. Right. It is a hypereosinophilic condition which occurs, very good, which occurs, very good Avinash. This occurs secondary to parasitic infection. Right. Secondary to parasitic infection. Now the question comes again now. What is that particular parasitic infection? What is that parasitic infection which will cause the Loeffler syndrome? This parasitic infection includes Strongyloids stercoralis, Dirofilaria immitis, or the Ascaris. Right, or the Ascaris. So these are the parasitic infections. These are the parasitic infections which will cause the Loeffler syndrome. Right? Now, in these parasitic infections, you have the presence of hypereosinophilia. Right? You have the presence of the hypereosinophilia. And this is what is called as the Loeffler syndrome. This is what is called as the Loeffler syndrome. All right. Next. Now, you see this question now. This question is on what? The miliary pattern on the chest X-ray. This question is on the miliary pattern of the chest X-ray. Now, the other point is you take the disseminated tuberculosis. Can anyone tell me what are the most common organs? What are the most common organs to which the miliary tuberculosis will spread? Yes, any one of you? What are the most common organs to which the disseminated tuberculosis will spread? That is to the, yes, so that is to the liver, then spleen, right? Liver and as well as spleen. And not only that, it can spread to all the organs. Disseminated tuberculosis means it spreads to all the organs. But most common organs to which this tuberculosis is being spread is liver and as well as spleen. Right? Liver and as well as spleen. Okay? Right. Now, there is an important question, that is, what are the conditions where you will have snowstorm appearance on the chest X-ray? Can anyone tell me this? What are the conditions where you will have the snowstorm appearance on the chest X-ray? Any one of you, please? Number one, varicella zoster pneumonia. Then number two, disseminated tuberculosis. Right, disseminated tuberculosis, which is nothing but miliary tuberculosis. Right, number three, yeah, miliary tuberculosis and disseminated tuberculosis is one and the same. Then just now we have discussed, that is Loeffler's syndrome. Now, or Loeffler's pneumonia. Apart from that, silicosis, you'll have snowstorm appearance. Then hemosiderosis, you'll have snowstorm appearance. Pulmonary alveolar proteinosis, pulmonary alveolar proteinosis, you will have the snowstorm appearance. These are the conditions where you will have snowstorm appearance: tuberculosis, silicosis, hemosiderosis, varicella zoster pneumonia, and pulmonary alveolar proteinosis. These are all the conditions where you will have snowstorm appearance on the chest X-ray. And what has been asked for you in the question? In the question, it is being asked, appearance as seen on the X-ray photograph of the lung is not seen. What is that X-ray photograph? Miliary tuberculosis. And where you will not have miliary tuberculosis? In Klebsiella. Why? Because in Klebsiella, you have that particular lobar consolidation. Right? Next. Now, we will move on to the next image. Yes, interesting question. Not seen in condition shown in the photograph. Right? Not seen in condition shown in the photograph. Cyanosis, barrel-shaped chest, association with smoking, type 1 respiratory failure. Cyanosis, barrel-shaped chest, association with smoking, type 1 respiratory failure. The question asked is not seen. Now, first of all, very good, Avinash. Can anyone tell me what is the diagnosis? What is the diagnosis of this particular image which has been shown to you? Very good, Avinash. So the image which has been shown to you, it is emphysema. Right, it is emphysema. Okay, now what is that you are observing? Right, you are observing abnormally dilated alveoli or airways. Right, abnormally dilated airways. Okay, now in this abnormally dilated airways, where you will have that, you will have that in patients with the emphysema. Now in emphysema, right, in emphysema you will have the presence of type 1 respiratory failure. This is correct, right? That means what are these structures? These are the alveoli which are abnormally dilated, and this alveoli, these are the one which are required for gaseous exchange. These are the one which is required for the gaseous exchange. Now once this particular alveoli are damaged, gaseous exchange does not occur, and that will make the individual to land up in hypoxia. That will make the individual to land up in hypoxia. So your type 1 respiratory failure, it is hypoxemic respiratory failure. Right, it is nothing but hypoxemic respiratory failure. And this emphysema, what is the most common risk factor? Most common risk factor, right? Most common risk factor, it is your smoking, right? Most common risk factor is smoking. Now, tell me a point here. Smoking will cause which type of emphysema? Yes, smoking will cause which type of emphysema? This smoking will cause the development of anyone? What type of emphysema you will come across with smoking? Very good, Raja. So you will see the development of centriacinar emphysema. Right, you will see the development of centriacinar emphysema, and in these patients with the emphysema, both the lungs, they are abnormally dilated. They are abnormally dilated. Because both the lungs are abnormally dilated, the chest, what you will have is, right, bilaterally dilated lungs. The chest, what you will have is the barrel shaped chest. And in these patients with the cyanosis, sorry, these patients with the emphysema, there is no cyanosis. There is no cyanosis in these patients. Because there is no cyanosis in these patients, remember, they are called as pink puffers. They are called as pink puffers. Okay, right? And cyanosis, you will see that in patients with a chronic bronchitis. Cyanosis, you will see that in patients with the chronic bronchitis. And in chronic bronchitis, because there is cyanosis, these individuals, they are called as the blue bloaters. Right? These individuals, they are called as the blue bloaters. Okay? Right. That is what you will observe in patients with the emphysema. So in emphysema, you will have the pink puffers, not cyanosis. In emphysema, there will be barrel shaped chest. right? Why? Because of the bilateral hyperlucency. Next, association with smoking is seen in case of centriacinar emphysema. Now, can anyone tell me what is the risk factor for the development of panacinar emphysema? Yes, any one of you? What is the risk factor for the development of the panacinar emphysema? Right. So the panacinar emphysema, it is present in alpha-1 antitrypsin deficiency. Right. Panacinar emphysema is seen in the alpha-1 antitrypsin deficiency. But the risk factor which has been given is smoking. Right. And in smoking, you'll have centriacinar emphysema. Okay. So now the question is, which is not seen in the condition shown in the photograph? Cyanosis is not seen. Cyanosis is not seen. Okay, right. And these individuals, because there is hypoxia, there will be development of the hypoxemic respiratory failure. There will be development of hypoxemic respiratory failure. Okay, that completes the discussion of the emphysema. Now, at the same time, let me shortly revise the types of respiratory failure. So, if you take the types of respiratory failure, we have another type of COPD, that is chronic bronchitis, right? And in COPD, chronic bronchitis, what type of respiratory failure you will have? Yes, in COPD, chronic bronchitis, what type of respiratory failure do you have? Any one of you? In chronic bronchitis, there will be development of type 2 respiratory failure. There will be development of type 2 respiratory failure, right? Very good. Whereas in emphysema, it is a type 1 respiratory failure. Right? Type 1 respiratory failure. Okay, right. So that is about the different types of respiratory failure in case of the COPD. Now, in these patients with the COPD, let me tell you, because the presence of barrel-shaped chest, these individuals, they will have on percussion. What is that you will have? You will have the hyper resonant note. Right? You will have the hyper resonant note. Okay, right. So these are some of the images related to your pulmonology. So this session, I will just wind up only with half an hour. And we will do one more session on images related to your pulmonology. This session, I'm winding it off. One more session we will do. In that one more session, we will discuss the image-based questions on the pulmonary function test. Image-based question on the pulmonary function test. That is, in obstructive lung diseases, what will be the pattern? Restrictive lung diseases, what will be the pattern and how will be the pulmonary function test? Right? So all that I will discuss in the next image-based session on the pulmonology. Right? So thank you very much. Good night and see you tomorrow again.